The opinions and views expressed on this program do not reflect those of the management or staff of Community Media of Staten Island.
Welcome to RUMC Vital Signs. In this episode, we're talking about a major life transition that affects every woman. It is often misunderstood and under-discussed: menopause. From hot flashes and sleep issues to mood changes and long-term health concerns. We'll talk with an expert about what's normal, what's not, and what help is available. We'll also walk through a day in the life of someone experiencing menopause. We'll discover some truths about menopause in our Myths versus Facts segment, and take you inside one of our Richmond Health Network OBGYN offices. A previous guest on our show, I'm joined by Dr. Rita Shats. In addition to her board certification in obstetrics and gynecology, she's also the first obstetrician gynecologist on Staten Island to achieve board certification in pediatric and adolescent gynecology. Welcome back to the show, Doctor.
Oh, thank you for having me.
Thanks. So what is menopause?
Menopause, in a nutshell, once a woman turns a certain age, 51 is an average,
Okay.
it's cessation of menstrual cycle. Mm-hmm. She's no longer menstruating, mm-hmm. and her body starts to change, mm-hmm. In more ways than one. Mm-hmm. First of all, mood swings, insomnia, weight changes, unfortunately gain, mm-hmm. Libido changes, and overall body changes. Mm-hmm.
Do you know why that's the age that it tends to happen most? Is there an idea?
Well, it's an average between when the actual hormones start to produce in the body, and that's when we see that type of change.
Mm-hmm. And there are stages to menopause, right?
Correct. Mm-hmm. The precursor to menopause is perimenopause, is the time when you start to see a cycle change, mood change, overall body change, at about age 45, mm-hmm. for some a little earlier, for some a little later, and that's the time frame before the menopause.
Mm-hmm. So menopause, so the symptoms actually start, so you're saying like the 50s are like where menopause actually sets in. So there's a number of years where perimenopause actually is occurring. And do most women confuse that and think, oh, I'm going through menopause, or do a lot of these changes in perimenopause go like kind of unnoticed?
I feel like it's interchangeable term of, menopause, perimenopause, because everyone expects to feel different as soon as their menses change, meaning stop. Once they stop their period, they know that, okay, it's 12 months, now I'm officially entering menopause. But now they slow down and start thinking, what happened before? Well, let's see, I had gained weight, my mood changed, my sex drive changed, my hair quality changed. Oh, it must have happened before. So perimenopause is the time before when women are starting to see changes, but the fact that they're not menstruating anymore officially marks them as menopausal.
Gotcha. And when should they say, okay, let me go see my OBGYN because I think I'm in menopause?
I always advise my patients, whenever you start to feel different, ask us, is it normal, is it not? Often as doctor, my hair starts to fall out. My skin starts to be drier. My mood starts to change. I'm more anxious. I'm more depressed. I'm more irritable. Now's a good time to go for blood work or to talk about something. So that's when I encourage it, usually around 40s. Mm-hmm.
And what treatment options are available?
Well, everybody wants to be organic and natural and not to take hormones. And that's okay. There are different options. You can have a hormonal treatment and non-hormonal treatment. By non-hormonal treatment is the supplements, your magnesium, your chasteberries, your ashwagandha, your D3, your B complexes. These are all the vitamins women try to take before, and it does help somewhat. Mm-hmm. But nothing like good old hormonal replacement to make you feel so much better. Not everyone is a candidate, but if you are, you should definitely speak to us.
So the supplements that you just mentioned, those are all over the counter?
All over the counter. Good old pharmacy, local pharmacy carries it in the vitamin section. And it's a good start, just to do a little bit extra and along with your other supplements and vitamins.
And you mentioned the hormonal treatment. So who is a candidate for that?
Somebody who doesn't have prior history of breast biopsy anomalies, abnormal uterine bleeding, any prior history of stroke, clots, anything that has to do with cardiovascular disease, uncontrolled blood pressure. These are not good candidates. However, we need to talk to the patients and see what medications they're on. There's other contraindications to treatments. You have to be very careful. Just because it's available, and now that the black box label is off, the hormone replacement, everybody's rushing in to get their hormones, but just remember, because it's available does not mean it's for you.
Right. And how is it administered? Is it an injection? Is it pills?
The market is very wide. You have I call the potions and the lotions, which is in cream form of that. You can have the good old pill, the patch. You have injections. You have the bioidentical hormones. And this is all available. And there's no right or wrong. You just have to start somewhere. What works for one may not work for the other.
And how long is the treatment?
Well, that's a big million-dollar question. How long do you want to feel a certain way? Do we have to stop hormones after a certain age? My answer is no. You have to be very careful of how you monitor the patient, make sure we see them more frequently. Usually a checkup is once every 3 years, if the pap smear is every 3 years, if normal. But for a well visit and hormonal check, you can do every 6 months, depending on how well you feel or how not well you feel.
And one of the things that I think women think about is menopause marks the end of my ability to have children. If a woman is taking birth control, does that mean she can stop because she's in menopause, or she should continue to take?
So I think once you realize that you are not menstruating, you're no longer able to conceive. That means official menopause for a year, 12 months. Anytime before that, you could still get pregnant. So if you're on birth control by your provider for birth control, maybe you should come off and test your blood work to see whether you certainly may not need it, because if your ovarian reserve or ability of ovaries produce hormones and your ability to get pregnant is low, you may not need the birth control anymore.
And so we talk about these symptoms of menopause, the hot flashes, the sleeplessness, all these issues. They sound like temporary conditions. Is there any long-term health concerns around menopause?
So yes, once a woman enters menopause, you stop producing estrogen. And we all know that estrogen is good for your bones, for your heart. So even though women, when they're menstruating, they're at low risk for heart diseases, once they get into menopause, guess what? Their risk is high. It's actually higher. So estrogen is actually good for your heart, for your bones, most importantly for your brain and for your wellness. Let's face it, Alex, I can't stop the clock. I can't reverse
Haven't gotten there yet?
I can't reverse the clock.
Right.
But I can help them feel better, knowing they can have a better, fulfilling life. They can enjoy sex. They can enjoy life. They could be more upbeat. They don't have to be tired. Their brain doesn't have to be foggy. Why not? Why not give them that?
It's true. And so if the early 50s is when menopause starts, when do most women see these symptoms subside?
Some never do.
Really?
Yep. I have ladies in their 60s, even later on. Oh, I'm having a hot flash. Oh, I'm having a brain fog. Oh, I'm having vaginal dryness. It cannot go away, or it can, or did we get used to that lifestyle? Did I get used to having a hot flash and I'm opening the windows and I'm taking my clothes off? I don't know.
Right.
But some people still feel their symptoms later into their 60s.
Wow. But it's manageable, it sounds like, for most
It's manageable. We're here to help.
Right.
Live your life to the fullest.
Right.
Remember what you asked me. Well, how did I answer? Your life, you live one life.
Right.
Live it to the fullest. Enjoy it.
So it sounds like you answered my next question, but I'll ask it anyway. So what do you wish women knew more about menopause now before they come and see you?
I think they have to do their homework. Everybody's fascinated with ChatGPT and Google.
Dr. Google.
And Dr. Google, who never went to medical school. However, you can come in with your questions and be prepared. We love very proactive patients. But we also want you to know that it's not for everyone. Let me screen you. Let me ask the proper questions to see whether you fit the guidelines. But women need to be educated. Read your books, learn about supplements, learn about hormones. It's not all bad, but it's not always all good. You have to be the right customer for the right product.
Well, that sounds great. Well, that's going to end our first segment. Thank you. We've talked about the medical side of menopause, but behind the symptoms are real women trying to just get through their day. Next, Dr. Shats will walk us through a fictional story that reflects what many women experience. Welcome back. Not every menopause journey looks the same, but many women share a remarkably similar experience. Dr. Shats will walk us through a fictional patient's story built from what she sees with the majority of her patients. So I guess the easiest way to start is we want to come up with the name of a patient. How does, or a person, how does this whole process start?
You want me to come up with a name?
Come up with a name.
How about Jane?
Jane.
Jane.
What is Jane?
No, I changed my mind. How about Rita?
Rita, okay.
Yes.
So what is the first onset that Rita feels something's not right? Something's wonky.
One of the first things Rita felt was hot flash, brain fog, fatigue, lack of energy, not willing to get out of bed when you have to run out of bed.
So this is not fatigue from exercising, this is fatigue just...
Not from daily chores or daily routine life, because this has been her life. She's having a hard time getting out of bed. She has a hard time focusing. Her husband is asking, when can we have relations? And she's saying, I'm too tired, not interested. Her sex appetite has changed. She's tired.
So it's decreased.
Definitely down, yes. And she touches her hair and her hair is thinning. She touches her skin and it's drier. These are some of the things that Jane or Rita felt and didn't know how to ask her doctor. She talked to her primary and her primary referred to her GYN.
And these symptoms don't just happen at once. They happen over...
Yes, and it doesn't just have to be all the symptoms. It could be one, then gradually another, and you see a pattern, you see it's changing, it's increasing in frequency, and the questions start to pop on the head. Is it normal? Is it something I'm supposed to be feeling? Am I aging? Or am I depressed? Or what's happening? Do I need a vacation? She goes on vacation. She can't even enjoy her vacation because she's feeling exactly the same. She also can't sleep through the night. She gets up to go to the bathroom several times. She can't fall back asleep.
And so I assume for most of the patients that you see, Rita in this case, these are happening in a succession of symptoms. At what point do they go on, or are they experiencing them before they finally make the conclusion that, hey, I might actually be going through menopause?
I think once the people around her keep telling her, you're too irritable, you have to take it down a notch. Or her husband is saying, you don't love me anymore, you don't want to have a relationship with me, you're short-tempered. Mom, I told you this 2 minutes ago, how are you not remembering this information? So these are the things, people around her brought that to her attention. And she didn't feel the same. And then she went on to put on her favorite pair of jeans, and guess what? They don't fit. And then she always had a flat stomach, and now she has a pouch. What is that? Never had that. So the belly menopause, menopausal belly, however you want to word it. It's happening. It's happening. She notices more. Not to mention the wrinkles around the eyes, but that's another story.
And at what stage or how long have is Rita experiencing this before she finally picks up the phone and says, I'd like to come in and talk to you?
Well, it depends on her ability and how comfortable she is with her provider. Some people feel, oh, they're gonna think I'm crazy because I tried to talk about it last visit. I tried to mention it last visit, and they told me, oh, it's normal. You're not the same person. You're not 20 anymore. Your metabolism is slower, or you're just not that young girl you used to be. You can't have the same things. So I think that person has to recognize when is enough is enough. For some people, it's 3 months of symptoms. For some people, it's 6 months of symptoms. The sooner they recognize something is not right and come see us, the faster we can help them.
So it sounds like Rita would be more dismissive of a lot of these symptoms before making the connection to menopause.
It could be also cultural, or the fact that her mother never spoke about it, or it's not customary practice in her household to talk about it, or her mother's not around anymore to ask a question. And I think it's personal as well. Some women feel like they're resistant to change. Because remember, your brain is not thinking what you are. You don't feel a certain age. You want to be different. You want to feel young.
Yeah. So Rita finally picks up the phone, she makes an appointment and comes to see Dr. Shats. How does that initial exam begin? Because I'm imagining it starts with a conversation as opposed to a physical exam, or am I wrong?
Absolutely, always a conversation, because you can get your diagnosis from talking to a patient, getting a very detailed history. You have to allocate adequate amount of time. And, it's very, very common in our offices. First, a medical assistant comes in, or a nurse, and says, why are you here? And, it's a touchy subject. I'm here because my periods have changed. And usually that's enough information for me to go off of. And I start asking, when was your last period? Is it normal? Is it regular? Is it regular? And then I'm starting to get more information slowly. Some patients are very vocal and give you everything on a platter. So I feel this. And some people give you a little bit at a time. It is my job to bring it out. The more I get, the more I give. So if she tells me she has hot flashes, I want to address that. If she has insomnia, I want to address that. If she has weight change, I want to address that. If she has hair loss, I need to address that. If she has low sex drive, I must address that. Everything has to come to me to a full circle. The more they tell me, the more I can give them.
So you're treating the physical, mental, emotional, all of that in one?
I think we do it all. I think a gynecologist is a psychiatrist, a primary care, and now a menopause manager, a perimenopause man. We have to be. We have no choice. We're dealing with very delicate patients. Females are very delicate and very sensitive and special.
Well, stories like Rita, like this, raise important questions about what's true and what isn't about menopause. Up next, we'll do our myth versus facts section. Stay tuned.
Your life sounds pretty great. Don't let a buzz ruin it. Buzz driving is drunk driving.
There's a lot of misinformation about menopause. So what better way to clear some of it up than in our myths versus facts section? So Dr. Shats, I'm going to read you a few myth or fact statements, and you can tell me if it's a myth or a fact, and then just provide some background on the question. So our first one, myth or fact, menopause symptoms are mostly psychological.
Myth.
Myth or fact, during perimenopause, women may still menstruate.
Fact.
Okay. Myth or fact, hot flashes can occur any time of day and may vary in intensity and frequency.
Fact.
So they don't just happen at night?
No, but that's a myth.
Okay.
A fact is it could happen, and it's not always a hot flash. It could be actually a sensation of heat just raising, usually from your chest up. Or it could be cold sweats. It could be either or.
And it builds across the body, or it could be a section of the body, or?
Either or.
Interesting.
Everybody's different.
Okay. Myth or fact, if you menstruate earlier in life, you'll hit menopause earlier in life?
Myth.
That is a myth. So there's no connection between the two.
I don't think so. I think there's different scenarios. You could be on certain medications that can prompt you to go into menopause earlier. For instance, smokers can actually go into menopause earlier. Certain life factors can trigger. Certain medications can make you enter menopause earlier. Doesn't matter.
Myth or fact, menopause automatically always causes depression?
Myth, because it could actually cause the opposite, anxiety.
Myth or fact, you should avoid exercise during menopause because it's too stressful on the body?
Myth, myth, myth.
Why is that a myth?
Because I think women who exercise actually cope with menopause better. Everybody knows that when you exercise, you release endorphins, the happy hormones, and they actually make you feel better, stimulate you to do more, actually make you feel better.
Yeah, okay. Myth or fact, brain fog is common during menopause and is usually temporary. It is not a sign of dementia.
So let's address it in two parts.
Okay.
So brain fog is temporary, yes and no. If you don't do something about it, if you don't manage it, it could actually become more long-lasting. It can take over your entire life.
So how do you manage it?
You can start with estrogen. You can supplement with vitamins. And you also have to rule out other causes for that.
What is a common sign of brain fog? I mean, obviously we're going to say forgetfulness, but that can be anything. It could be stress, you're not remembering. How do you know it's brain fog related to menopause?
Let me act it out for you. Ask me a question.
Okay. Once menopause ends, symptoms and concerns associated with menopause, like bone and heart health, disappear completely.
Oh, the bone and heart health. That actually can. Could you repeat the question again? I'm sorry. I just had a brain fog.
Oh, okay.
It just can happen. Your brain is thinking, your mouth is not telling.
Gotcha.
You stop in the middle of a sentence, which is quite scary. Am I having Alzheimer's? Am I having dementia?
Sure. Yeah, I can imagine that.
But it's what happens. You just lose your focus, your train of thought. You have the information, just can't give it.
Wow. And our last one, which you actually talked about earlier, myth or fact, once menopause ends, symptoms and associated concerns like long-term bone and heart health disappear completely.
Myth.
Well, as you said, everything is all related together.
It's all related.
All right. Well, thank you, Dr. Shats. Hopefully we've cleared up some misconceptions around menopause. When we come back, Dr. Shats will take us on a walkthrough of her practice and share some of the services she provides for her patients.
What are you looking for?
Located at 2 Teleport Drive, Suite 207, just off of South Avenue, Dr. Shats sees patients of all ages along with her medical partners. So tell us, who are your partners?
I have two wonderful partners. We've been married in a partnership of OBGYN practice since 2007. We will start with I hate to say it, with the olders. Dr. Anna Pavlidis is my partner. Dr. Michael Benson, followed by me, Dr. Rita Shats.
So tell us about some of the features of your office.
We have a very large, I think for Staten Island, maybe it's bigger somewhere else, facility. We are about close to 7,000 square feet of 10 exam rooms, 3 ultrasound rooms, an operating room suite, and a recovery room suite facility. We provide services from adolescent pediatric gynecology to obstetrical care, high-risk obstetric, surgical care, minimal invasive surgery, robotic surgery, and menopause hormonal management. all in one. I'd like to call it a one-stop shop because it is now not to really.
So you do all that in the office, that's all in-office procedures.
Yes,
wow.
Yes, not to release my age, but I've actually started to deliver the babies of the babies I delivered. This is scary.
So you're a multi-generational practice now.
A multi-generational practice. That's what we are
that's
officially.
How you stay in business.
That's it. That's how we do it.
So tell our audience that if someone's looking for assistance with menopause or OBGYN services, why should they come to your practice?
I think because we take each patient and we care for each patient individually based on individual needs. It's not a cookie cutter model. Everyone is different. Everyone needs different care. Everyone requires different services. We have 3 physicians. We have a physician assistant on premises as well, who helps us manage patients. We see all kinds of patients. We'd like to care for all our patients. We are a busy practice. However, we know everything about every patient. So if you're looking for comprehensive care for your wife, for your sister, for your daughter, for your mother, for your grandmother, please come see us at 2 Teleport Drive.
That sounds great. And you have the seal of approval of multi-generational patients. So
That's correct.
So again, the office for Dr. Shats and her partners is located at 2 Teleport Drive, Suite 207. For more information and to schedule an appointment, call 718-273-5500. When we come back, we'll wrap up our episode with some parting words of advice from our special guest.
Got a new house.
I think I finally found a place that I call home.
So as we've learned today, menopause is a natural part of life, but feeling miserable doesn't have to be. With the right information and support, women can navigate this transition with confidence and good health. As we come to the end of our episode, it's only fitting that we let our guests have the final word. So Dr. Shats, what are some of the last parting tips that you would give to women who may be experiencing menopause?
Don't be afraid to ask a question. What you think is abnormal might be normal, or the other way around. If you feel different, if you look different, please ask your provider. Let them tell you what is normal, what is not. Don't be afraid to embrace menopause or perimenopause. Help is here. Don't you fear, if I may. But not to commercialize, not to say that hormones is the best thing ever, but let us try to help you. You don't need to take the hormones if you don't need to take the hormones. But if you feel, and we feel it could help you, don't be afraid.
That is a great way to end the segment. You're always a great guest. Thanks for coming on.
Thank you for having me.
A reminder that if you'd like to schedule an appointment with Dr. Shats, her office can be reached at 718-273-5500. And again, her office is located right here on Staten Island at 2 Teleport Drive, Suite 207. For additional women's health information, you can visit our website at rumcsi.org and follow us on Facebook, LinkedIn, Instagram, and X. Richmond University Medical Center has cared for Staten Island for over 120 years. You can help ensure that care continues by making a financial contribution to the hospital. To donate, visit our website and click on the Donate button located at the top of the home page, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.
This program was produced through the facilities of Community Media of Staten Island.